among the list of the terms, let's first define the psychiatric mental health nursing. And this is to be followed by the mental health. We will also define the mental illness and the mental health continuum. Okay, let's proceed. Now, in your screen, you may notice that there are a lot of words. And these words are all definition of the first terminology, the psychiatric mental health nursing. Now, this is too wordy for me to read. What I want you to do is I want you to read with your own eyes, silently. You may skim and scan. And I want you to notice something that is common among all the definitions. By the way, there are 4 definitions. The first definition has been defined by the American Nursing Association. The second definition and the fourth definition are just generic definitions that you may find as a common definition of the word psychiatric mental health. And the third is under the name of Haber and Billings. That's 1993. I bet and I guess you are now scanning the terminologies, the definition. I'll give you a little some time. Try to notice what is something that is common among all of these definitions. A little more time. Okay, I think that's enough. Let's take a closer look now. What among all of that 4 definitions seems to be common that you have noticed? Now, this is the way how I look at it. Take a look at this. At the first definition, I am seeing there the term mental disorder. And even in the second definition, there's a mental health problem. And even on the third, there's a mental disorders. And even on the last definition, there's a mentally ill definition. That's why the term that we're trying to define is psychiatric mental health nursing. That means we will be dealing with the mental health problems. And when we say we, I am pertaining to us as a nurses. That means we will be having a nursing practice dealing with mental disorder. Are you ready for that? Now, not only that, nurses will practice an interpersonal process, that the nurses will be involved not only in the practice of human behavior assessment, it may also include the treatment and rehabilitation. And with all of that stages, we are involved because it is so named as psychiatric mental health nursing. Now, I'll be showing to you a clip of our senior nurses from a different part of the world, and I want you to notice how they define psychiatric mental health on their own words. Let's take a look and listen.
Caring for people who are misunderstood by many other people.
Wow, that's too sweet. If you may notice, she said she's caring for people who are misunderstood.
This is a profession of the heart.
To understand and be able to empathize and understand where patients are coming from. So I also really enjoy sharing that with the next generation of nurses.
All nursing is psych nursing. It doesn't matter where you work, you're going to have psychiatric patients. I feel like I've saved lives.
They are saving lives. You listen to the terms that they're saying. That's something else. It's coming from their heart.
Being a nurse is the greatest joy of my life. Psych nursing is a little bit like being a detective. You get to learn people's stories and help them through the good times and the bad times in their life.
It can be.
She just said, if you're a psych nurse, you're like a detective. You're trying to know the good side, the bad side, and a lot more.
Career, you can do so many different things with psychiatric nursing. I love integration. I think the whole health begins with mental health.
I love what I do. I feel that I'm called to do it. I love seeing people live happier lives. Even less.
Look at what they're saying. They love what they do. And I wouldn't hesitate asking you, Maybe probably after this discussion or after taking up psychiatric mental health nursing, this may be the avenue or specialization that you may happen to like.
20 years, I've seen psychiatric nursing grow so much, and our understanding of behavioral health issues, no matter what kind of nurse you are, you're doing psych nursing and what you do.
Okay, that's it. We'll pause from here, and in my next discussion, we will be talking about another terminology to be defined, and that would be the mental health. Let's continue that later on. After defining what psychiatric mental health is all about, at this point, we will focus on defining what mental health is. As you may notice in your screen, there are two definitions of mental health. And this has been defined by two reputable organizations or institutions. Namely, we have the World Health Organization and we have the APA or the American Psychiatric Association. Now, let's focus first on the definition of American Psychiatric Association. According to their definition, mental health is when you succeed at your work or in your emotional life, when you have this capacity that you are matured enough for the resolution of conflicts, then that's the time we can say that you are mentally healthy or you have what we call the mental health. Now, let's take a look and listen as to how mental health is being defined by some experts.
What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices in our lives. Mental health is important at every stage of life, from childhood and adolescence through adulthood.
That is a very tangible definition of what health is all about. That he says and he narrates that there are aspects of life that you have to be good, and that is physical, your mental, and your emotional well-being, which sounds synonymous with the definition of World Health Organization. It states here that your physical wellness, your psychological, and your emotion or your feeling must be coordinated and organized. And that is what he exactly narrates. According to him also, that you can have a good mental health if you are able to handle your stress. And that is very common in our present life. Every day we meet and encounter stress, and he says, in order to be mentally healthy and sound, we must be able to handle that stress and how we relate with each other, how we treat one another, and definitely what the choices that we make in our life. Further, he reiterated as well that mental health all started from the moment you are young up to the stage of adolescenthood, and even when you are at an old age, you should be able to cope up and have this mental health. Or what about if we listen to some other experts talking about mental health at the point of view from the World Health Organization?
No less an authority than the World Health Organization has said that there is no health without mental health. So from the very highest levels of healthcare, there is a recognition that you cannot truly be a healthy person without attention to mental health as well.
And so that's it. He says you can never be healthy overall. The big word there is the word health. And from that health, we cannot do away and we cannot exclude mental health in order for you to have a full definition of what is health is all about. We cannot exclude mental health, according to him. Let's continue.
And while we're all familiar with mental illness, the absence of mental illness does not necessarily mean that someone is mentally healthy. What are some of the components that go into being mentally healthy?
Further, according to him, it doesn't necessarily mean that if you, in your present situation, if you do not have a mental illness, it doesn't guarantee that you are mentally healthy. And that's not a point that we have to consider, that if you don't have mental illness, you are mentally healthy. No, it's a no-no according to him. Let's further listen.
Being able to understand yourself and what your needs are, what your emotions are, and so on. Being able to communicate your needs to others, hear what they have to say in an empathic way, and to be able to resolve differences there. It's important also to know how to cope with challenges in life and also how to be resilient, a skill that we can learn. And so it's very important for us to all work together to incorporate mental health as part of our overall health profile.
So he's talking about the overall health profile, and he says that in order for you to be mentally healthy, you should be able to understand yourself. And that's the first thing that matters most, as to what I understand. You should know what you want, you should know what your needs are, you should know what your emotions are, how do you feel right now, and that you should be able to resolve differences as to wherever you are. By this, that is a very good definition that we have sought from World Health Organization and from the American Psychiatric Association. Let's continue. In our search for a more meaningful definition of mental health, we have here an additional definitions from different authors. One of that is from Carl Menninger, and according to him, mental health is an adjustment between the human beings and the world, and that will lead to effectiveness and happiness. Now, next to that is that mental health is a balance between individual and the surrounding world. And finally, in the last definition down below here, this is synonymous with the definition of World Health Organization, that is emotional, psychological, and social well-being of a person that can lead to coping, positive self-concept, and emotional stability. And there is a very intriguing question here as to why is mental health important? Now, in the next clip that we will be seeing, we will be hearing some insights from an ordinary individuals from the different walks of life, and they have no even background about health education and even medicine. And let's see, how do they perceive mental health?
But how do you define mental health? And how do you stay mentally healthy?
Mental health to me just is taking care of yourself. I think getting enough sleep, staying stress-free, spending time for yourself, having a good time.
It's about mental wellness, really, I think. And so being your best self and feeling good most of the time, and having energy and being able to enjoy each.
Okay, as you may notice, in their perception, first, he lamented that mental health is about more on physical aspect of life, having a good sleep, being happy all the time, and coping with stress. And the other definition was that mental health was compared with mental wellness, which is almost the same. And finally, the last definition was that mental health is always somehow, in anyhow, associated with mental illness. We cannot do away with that because most people, they do perceive that when somebody says mental health, it has something to do with mental illness. And at this point, in our later discussion, we will be talking about and we will be trying to compare what is mental health and mental illness. After a thorough definition of what is psychiatric mental health nursing and an exhaustive search for the definition of mental health, at this point we have to define what is mental illness. Now, as you may notice, we have here two definitions from reputable organizations or institutions, such as the definition from the World Health Organization and the American Psychiatric Association. Now, what is remarkable about their definition is that they have coined the term, or they have coined the word alteration, impairment, and or either an imbalance. Now, this terminology is best describe what's going on with the cognition or thinking of the patient and the emotion of the patient and social condition of the patient. And all of this alteration, impairment, and imbalance are being brought about. This is a result of either a changes in social, psychological, genetic, chemical, or either a biological disturbances in one's mind. Now let's take a look and listen as how further it is being defined by some experts.
Mental illness can come in many forms. No wonder this is a topic many find hard to talk about. The American Psychiatric Association defines mental illness as a health condition involving changes in thinking, emotion, or behavior. These conditions may affect someone's ability to relate to others and function each day.
Okay, based on her definition, another word or terminology that will describe mental illness is that there is a changes. There is an alteration, there's an impairment or imbalance in either the cognition or thinking, the emotion, and the behavior of a certain person who's suffering from mental illness. The features of a mental illness. After defining what mental illness is, we have defined that it is a derangement, an alteration, or changes in either a behavior or cognition and changes of a social pattern of an individual. Then we may say that a mental illness can be described by the features. And these features of mental illness can be classified under four headings. One is that it is possible that a client will have a bodily function disturbances. That means there will be a changes in physiological functions of the individual, whether it is a cardiac function, whether it is a respiratory function, a urinary function, and all the bodily functions will be altered in the event that the patient will suffer from mental illness. Other than that, it is possible, and the highlights would probably be the mental changes or disturbances in mental function. And when this happens, there will be a lot of changes. And one of the marked changes of them all would be the presence of delusions and hallucinations. When we speak of a delusions, this will pertain to a fixed false belief that the patient will believe in something that is false, something that is not real. And it is possible that the patient will have hallucinations. And this hallucination can be described as an apparent perception of something that is not present. In our later discussion with some other types of psychological illness or mental illness, we will be dealing closely with delusions and hallucinations. And these are the marked mental function that changes whenever the patient has a mental illness, considering that there can be confused thinking, there can be suicidal thinking, which is the worst of them all. There can be an extreme anger and hostility, and denial of problems is possible. Now, the third classification of the headings of features of mental illness will be a change in individual or social activities. At this point, the client with mental illness may have so many manifestations, such as he will be having a withdrawal from society. He will be having a prolonged mood disturbances, an excessive anxiety, fear, and suspicion, and an abnormal self-centeredness. He can be very prone to abuse of alcohol and drugs. And somatic complaints will be possible. There will be a lot of bodily malfunctions, which in any way, somehow it can be described as untrue. The patient may be complaining of something, but the reality is that his body is having abnormal functions. And on top of all of this, mental illness will be described primarily by a marked personality change and the inability to cope up with the daily activities. Now, let's pay a look and a listen to how mental changes can be described?
We all experience periods when we feel stressed, worried, anxious, sad, afraid, or angry. These are all normal emotions. However, when these emotions become severe enough that it interferes with a person's ability to function daily, and these feelings become persistent over time, then it can develop into a mental health problem. There are many different types of mental disorders. When left untreated, mental disorders can be chronic and long-lasting, and are associated with increased disability. They significantly have an impact on daily functioning and frequently interfere with family, social, and work responsibilities.
Now, what has been discussed here very vividly is that it's just normal to have changes and variations of emotions on our day-to-day interaction with the people around us. But the problem will sink in if that changes in our emotions will be prolonged. If that will become chronic, then it may happen to alter with our daily activities in our daily life. And there goes the big problem of having a mental illness when we cannot cope up with stress, we cannot cope up with the demands of our everyday activities. And we will be talking more about mental illness in relationship with several classification of mental problem in our later discussion. Now, at this point, we will be talking about the criteria for mental health. This will answer the question as to, are we still sound? Do we still have a sound mind? Are we mentally healthy? Now, this criteria will be laid down as to answering the question of the query of mental health. First among the criteria is that you have to have an adequate contact with reality. That simply means you have to ask yourself whether you are in touch with reality, and that is by asking yourself, like, who am I, where am I, and what's going on with things around me. If you are able to answer that questions, probably you have passed the criteria of adequate contact with reality. Now, another criteria is that you should have a healthy emotional life. That means you should, although you are having a roller coaster of emotions at times, you should be able to handle all of that. And you should be able to manage how you will react and how you will carry and handle your emotions. Next, that would be a positive self-concept. You should have a good outlook in life. You should at all times be optimistic at life. You should look at the brighter side of life, and not at all times you are sad, melancholic, and lonely. The fourth criteria would probably be the social acceptance. You have to check it out whether you are still accepted by your friends, your family, your peers, and all the people around you. That will dictate whether you have a good social acceptance. And the peep of that is that you have to have a control of your thoughts and imagination. There's a saying that you have to be very careful of what you wish for, and you have to be very careful of what you're thinking, because what you're thinking might become real at one point in your life. And efficiency in work and in play. This is going to be a measure of how effective you are. If you are a professional and you're working and you are discharging your duties, then it will be measured by your efficiency at work. And for students like you as well, you should be able to cope up with your studies. Not necessarily being on top of your class, but just be able to have a passing mark and be able to excel at times. Now, there is also what we call an indicator of mental health. And as portrayed by the video, let's take a look and listen.
Being mentally healthy means being resilient and able to cope with difficult times, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationships.
If we may look at it, this is almost and all also synonymous with what we have discussed at the left. You should be in control, you should be confident, you should be feeling good, expressing emotions. A relationship is about social acceptance and being resilient, a positive self-concept. And you better check it out for yourself. If you are within the criteria that I have made mention, then probably can tell yourself that I am mentally sane, I am mentally sound, and I am mentally fit for whatever task of the day I am dealing with. This slide will take us to the discussion of a model of a mental health continuum. Now, a continuum, as we may say, continuum is a range. It pertains to a sequence or a changing level of progression. And if you may notice, there is an arrow going to the left and going to the right. If you are on the extreme left of a continuum, that means you are on a healthy state of mental wellness. However, as you face the challenges of every day, as you face the stresses of every day, the circumstances, then your body and your mind may tend to react on that situation. As what we have discussed earlier, there can be several emotions along the way, and this can be common and reversible distress. It will depend on how you carry yourself, on how you fight back on that circumstances of life. However, on one point, if you are moving on, changing range, going up to the injured level of the continuum, there will be severe and persistent functional impairment, and that's not healthy anymore. You are unable to cope up until you reach the worst side of the continuum, which is the ill area, and there sets in the mental illness. There will be clinical disorder and there will be severe functional impairment, and that's not good at all. You were defeated by all those circumstances, by those problems, by those stresses, and you were not able to cope up if that's the case. You are at the severe extreme right area of the mental health continuum. Let's listen further as how continuum affects an individual.
It's best to think about mental health as being on a continuum, rather than people being either mentally ill or mentally well. We are all on the continuum, and we move up and down according to factors such as our genetic makeup and upbringing, our life circumstances, and the stresses we are under. At one end of the continuum, we have mental.
It is very clear here, it has been portrayed here that we are all walking through that continuum. We are all striving and trying to reach ranges in this area of continuum. When you are, a ladder is being described here, is being shown here. And that it says that if you are at the lowest side of the continuum, then you are on a negative area. That means you are on a mental illness area, and that's a negative side of it. It's possible that you can have depression, you can have anxiety, and that will lead to a not so good situation. And we are all walking here. And it will just depend on how resilient we are with all those problems that we encounter. Let's continue.
Disorders, like depression or anxiety. And at the other end, we have states of positive mental health, when we're thriving, content, and fulfilled. The aim of mental health interventions is to move people up the continuum so that they're able to reach their full potential and live satisfying lives.
So that's it. It's been so clear here now that when you are at the lowest side of the ladder, then you will be suffering from mental illness. However, the goal of psychiatric mental health nursing is, of course, to push you to the upper side on the top of the ladder towards mental wellness. And of course, it will depend also on your capacity to come up with the overcoming all those circumstances, all those stresses that you may face in life. And that is what is mental health continuum model is all about. Having learned as to what is a mental health continuum, It is also necessary that we have to know what are the factors that can affect the mental health continuum. And with that, having said that, there are several factors that we have to consider in order to achieve mental wellness. And at the same time, it can either be a factor that may trigger you to go down to the level of mental illness. And most factors that affects the mental health continuum is that of the person or the support system around you. And they can be your friends, your family, or the community where you live in. And that will dictate the family influences the most. Whether you've been grown or you've been raised to have a strong religious belief, and that's how you cope up with the trouble every time. The environmental experiences that you've been through when you were growing up. And on the biological aspect, it is being said that it is an inherited factor to be mentally resilient to all of the problems that you may encounter, the development of the events that is around you. Considering as well, there are also, on the biological aspect, hormonal influences and health practices that affects your being a person, the strength of your personality. That's why there are people who we can call having a very strong personality and traits. And the demographics or the locations of where you thrive and where you live can also be a factor, together with the culture and beliefs and values that you are holding on to. And on the negative influences, it can either be a stressor of a psychosocial origin and poverty. So together, if you're going to combine all of these multiple factors, it can either change your destiny or location into the continuum. As we have said that we are traveling on a continuum, and we can be on a downward trend, or we can go up on an upward scale. And all of these factor, if it may be absent or its presence may severely affect the mental health continuum of an individual. There are factors that can influence an individual's mental health or a person's mental health. And as we have learned from the definition of mental health, we have said that mental health is wellness of your psychological, emotional, and social well-being. And that there are factors that can affect that, either for good or for bad. That means it can be on a mental health aspect or a mental illness aspect. And these are the following. One, the individual factors. That means you yourself. And number two, the interpersonal factors. That means how do you deal with one another? How do you engage with one another? And social and cultural factors, it has something to do with what's going on with the environment, and how do you keep yourself uh, adapted to the situation. Now, on an individual factor, you cannot help but ask yourself, if you have a very strong mental health and you are towards the positive side of the continuum where you become mental healthy, you may ask the question to yourself that if you do have all of these categories or these characteristics, then your mental health will be as strong as it is. If you are a person who has an autonomy, if you are independent and you have a high self-esteem, and you know your purpose in life, and you have this sense of belonging to everybody else, then you will have a very good factor that will determine your mental health. However, on the negative side, mental illness on an individual basis or individual factor will depend on your biological makeup. it will only happen, mental illness will only happen to you if you are suffering from a prolonged anxiety, worries and fears, and disharmony in life, and you don't have a purpose in life. It's possible that on an individual factor, mental illness will affect you. Now, on the basis of interpersonal factors, how do you deal with the people around you? You will be healthier psychologically if you are a good communicator or you have an effective communication ability, especially if you can help other people. However, mental illness on an interpersonal factor may set in if you have a poor communication skills and ability. You are a dependent person and that you always have trouble with relationship and you don't have your emotional control, then mental illness will affect you. Now, with respect to the society where you live in and how do you portray your values, then you will have a strong mental health if you have a sense of community, meaning you deal and you interact with the people around you, and you are not for violence. You have an intolerance for violence. That is a good indication of a mental health on a social and cultural factors. On the other side, mental illness will set in if in a social cultural factor if you have grown up in a situation where there is at all times violence, there is poverty and homelessness, and there's a lot of form of discrimination that you are experiencing: racism, the class of social class where you live in, the ageism, and the sexism, as to you discriminate what is a female and you consider that as a lesser or inferior uh, gender. So these are the factors that will affect the mental health. Again, the individual, the interpersonal, and the social, cultural factors.
That's all, folks. This has been your nurse Radiologico Guro saying thank you for watching and enjoy studying.